Good morning, everyone. Thank you for joining me. I am going to invite Dr. A of Happy Chompers and Katy, Pediatric Dentist, to get on and talk about lip tie, tongue tie, how to address it, and how to identify that your child may. Right now, I actually switched to Happy Chompers myself with my kiddos. So he has been instrumental in helping us to identify this in one of my children as well. Good
Good,
morning. How are you?
good morning. I'm happy to be here. I'm doing well. How are you?
Good. Thank you for joining
Of
us.
course, of
So,
course. Super excited.
this is Dr. A with Happy Chompers in Katy, Texas. And he is a pediatric dentist and is very familiar with lip tie, tongue tie, along with a bunch of other natural ways to make sure that the teeth and mouth are totally healthy. And so I asked him to join us today to discuss how to identify lip tie and the different treatments and why we need treatment and all the things. So, first of all, how do we know um, that a child may have these things?
Yeah, good question, right? So generally what we find is that, sorry, my phone keeps slipping here.
Okay.
Uh, Generally what we find is that symptoms determine diagnosis, right? So a lot of times when moms and parents come to us, it's generally a diagnosis that's related to functional deficiency or developmental deficiency that they're experiencing in their babies or toddlers or preschoolers' life. So it could be a range of symptoms. Symptoms can exhibit as early as when you start breastfeeding as an infant, when you have issues with latching, moms may have pain or discomfort at initial latch or sustained pain. You can also have incomplete um, latch, inadequate latch that leads to colic-like symptoms, gassiness, fussiness, lip blisters, so things of that nature initially, or prolonged feedings that the baby is just not getting enough. Baby's frustrated at the breast. It just seems like a full-time job, which can be very frustrating for a new mom as an infant because, naturally you want the baby to latch and grow and thrive and feed. So that's one of the presentations of deficiency from a lip or tongue tie or cheek ties. As an older toddler, if things have worked out somewhat okay with breastfeeding, then we see kiddos with issues at an older age, with speech, pronunciation, enunciation issues, with swallowing, feeding issues, as well as some open mouth breathing or airway issues, or sleep disorders that can be inherently tied down to your tongue ties or lip ties.
And these can present, in my experience, these can present even if you have had a lip tie, tongue tie revision shortly after birth. I'm so thankful that I found you because I didn't know that.
Exactly, exactly. A lot of times we find that if you've had a release done as an infant, there still could be a lingering problem that you just want to diagnose or keep a professional to take a look at just to make sure that the growth and development of the jaw is appropriate, especially on the upper palate. We find that on the upper jaw, babies who breastfeed are at an advantage other than numerous advantages from breast milk and breastfeeding that you experience as a baby and a mom. Increased immunity, obviously, your antibodies, growth, and all and development wise. We find that the upper palate benefits tremendously from the breast and sucking on the breast because it promotes proper palate formation. So we were finding that babies who are not breastfed for 3 to 6 months at a minimum are more prone to or predisposed to having a narrow upper jaw that can again be inherently tied down to an undiagnosed or untreated or unresolved tongue tie.
What about moms that are unable for whatever reason to breastfeed? How might they know whether there's an issue or not if you have a bottle fed baby?
Yeah, so just going back to if you've had a bottle fed baby, and that's perfectly fine. You know, not breastfeeding journey doesn't work out for various number of reasons for certain families, and as long as the baby grows and thrives, that's acceptable, obviously, um, and it's a good option. In that scenario, what we find is that if bottle feeding can still lead to some symptoms if you have a lip or tongue tie, right? So if you're still experiencing similar issues on the bottle, as in there's a lot of leakage of milk, patient is or the baby is very fussy still or gassy, and still takes forever to feed on the bottle, or there's clicking or smacking on the bottle, so that can still present symptoms on the bottle. So that would be one of the signs to look out for and seek help in regards to if you're exclusively bottle feeding. So that's one of the things. And then again, going back to when you start eating solids, if you start experiencing issues with proper swallow, you're choking on foods, develop texture aversions, you're doing a lot of spit up, pocketing food, taking forever to swallow. Those are again signs of a deficiency at 6 months onwards when you start introducing solids, right? So that will need further investigation. And if you ever notice any of your children just sleeping with the mouth open, right? So if and a baby, if truly the tongue is functioning properly, they're hopefully sleeping with their lips closed or as close to possible if when they're sleeping. And then one of the things you can look out for is if when they're sleeping, if you kind of push down on your lower jaw or mandible and then just push the lower jaw down, their tongue should suction up against the palate or stay up against the roof of the mouth as much as possible. But if they're not, or if they're sleeping with their mouth open or their tongue sitting in the middle or lower low tongue posture, that is again an indication of possible tongue tie, tongue tone, or tongue space where you have a narrow upper jaw, right?
Okay. That's good to know. Yeah, we noticed with my child that he was a mouth breather, and we're pretty good about their dental hygiene at home, but he was still getting cavities and things like that. And I didn't know that mouth breathing can also um, cause cavities.
Yeah,
So that's
definitely. Yeah, I mean, mouth breathing disposes or changes the oral microbiome tremendously because they're getting unfiltered air in your mouth throughout the night, and it just messes up and creates a huge imbalance between the good bacteria and the bad bacteria in your mouth. You're predisposed to getting inflammation just overall in your tonsils and your gum area or gingival inflammation from mouth breathing. Drier mouth with saliva is a great protector of teeth and the mouth in terms of balancing the good and the bad. And if you're mouth breathing, your salivary flow is decreased. So that, in combination with unfiltered air, just predisposes you tremendously towards having caries or cavities. So it's a big thing that we look for in kiddos who are experiencing high cavities rate.
and then can it also affect like it in my case, I feel like it has also affected his mucus levels and just nasal issues and things like that. Is that also the case?
Yeah, yeah, no, for sure. So, I mean, they've done recent data has suggested that recent studies have shown that if you're a mouth breather, uh, and you're processing unfiltered air through your mouth, it actually leads to inflammation in your body, especially in your tonsillar area. So if you mouth breathe and your tonsils, as a consequence, increase or hypertrophy or become inflamed, then you become more of it exacerbates the problem. You're not able to breathe through your nose, even more so. So we've seen that once you address the mouth breathing or the nasal airway deficiency, the tonsillar size in some kiddos actually becomes smaller. Where if you end up needing a surgery, sometimes the tonsils get small enough that you can avoid a procedure or a surgery, which is remarkable, because you're treating the underlying cause of that inflammation.
That's wonderful. So, speaking of treatments, so what options do you have once these things are identified?
Yeah, so again, we look at the entire picture. We do a functional assessment, look at your symptoms, mom symptoms, and an older child, looking at feeding, airway, sleeping patterns, as well as speech concerns and their previous history with feeding. So once we come to an assessment or agreement that intervention is needed, then you have options. Obviously, the more common option that we offer is a tongue tie, lip tie release or tissue tots release with carbon dioxide soft tissue laser. That's predominantly one of the options that helps release the tissue, gets rid of the oral restriction, and helping in getting help with other providers such as speech therapists, myofunctional therapists, as well as feeding therapists, kind of help alleviate the symptoms and resolve those. In some cases, we are also doing a lot more of photobiomodulation or laser therapy, which has been tremendously helpful in not only, again, sometimes avoiding a procedure in cases that just need that alternative laser therapy, where you get enough benefit from it that the functions improve and the tissue elasticity improves, that you're not needing to do a procedure with the laser. And that laser has been tremendously helpful. It's referred to as photobiomodulation, laughter, or baby lace, synonymously, and it's been helpful in helping deliver a more conservative approach to just your standard frenectomy with a laser procedure. And it's also been tremendously helpful in getting these families and babies ready. A lot of times we just offer it as part of the procedure, because we find that it helps preoperatively getting the baby ready and the tissue ready, and then using it postoperatively for healing, because it induces blood flow to the area and allows for quicker healing and optimal healing.
And that's something that you have at the Happy Chompers office, correct?
Correct. We provide that service at the office.
And what does it look like to bring a child in? They just call and make a new patient appointment with you.
Yeah. Yes, so very easily accessible by phone. Obviously, you can go on our website as well and schedule an appointment on our website for a consultation. You can also email through the website, voicing your concerns, and we'll reach out to help you schedule that consultation. So either phone, website appointment, or just sending in a questionnaire to have us call you back.
And okay, and two things that I love about working with you myself is that you have a very comprehensive questionnaire that helps kind of identify some of these things and know whether the child has any fears going in, and so you can tell that you really care about them, and also that you're open to bringing in those other practices within your practice. Like if they're working with a speech therapist or a myofunctional therapist, there, that therapist is actually allowed to join them and be a part of the conversation so that there's not a disconnect, in how, if you were to meet with us per se, and were to go back to, say, a speech therapist, myofunctional therapist, and try to relay the information, no, they can come in with them and sit and hear it firsthand and ask questions and all the things. So I really appreciated that myself.
Yeah. Yeah, no, I definitely can't agree more. Our philosophy has always been a team approach or a collaborative approach. We work with pediatricians, we work with speech therapists, myofunctional therapists, lactation consultants, chiropractors, you name it. Our goal is to be cohesive in our approach and treatment. We want other providers to give us their feedback in providing a more comprehensive treatment plan for our patients. Because I feel like there is a huge disconnect where one provider does one thing, and a lot of times that's not communicated back and forth with the other providers that are taking care of that child. So we're trying our best to bridge that gap and make sure everybody involved with that kiddo's life is on the same page, including obviously the parents.
Yes, that is one of the many reasons that Natural Health Network exists, is to connect you to the other providers that are on the same wavelength. And so I so appreciate you being a part of this organization. If you're watching this back and you have any questions, go ahead. I've also tagged Happy Chompers, and Dr. A's team, I'm sure, can get back to you on any questions. They do have a listing on the naturalhealthnetwork.org. And you can check out my interview with Dr. A, check out his office, see his philosophy further. If you think that he might be a fit, you'll know for sure by the time you check out that directory listing. So thank you so much for joining me. Thank you for your time. And I really appreciate all the insight that you've provided.
No, yes, I'm excited to talk about this. And like I said, you're a great resource. The team, the directory that you guys are putting together is a great resource for parents to advocate for their kids and really seek out the providers that have the best interests of their children in mind. I'm happy to be part of it, and thank you for having me. It was a pleasure.
Thank you. Thanks so much. Have a good day.
You too.
We'll
Take
see
care.
you soon. Bye bye.